Good morning. I just wanted to talk to you guys a little bit more about central lines and how they relate to pediatric oncology patients. I know Katie briefly kind of talked about these lines and explained the differences in her presentation, but I just wanted to go into a little bit more depth because this will definitely be an aspect of care and procedures, and knowing the differences is really important as you become child life specialists. The website, American Cancer Society, does a really good job of kind of laying out central lines, the differences between them, the brand names, which I know can be a little bit confusing, which I'll tell you a little bit more about, and kind of what are the reasons or the differences about which cancers have which central line, and which ones might have something called what the port. And so I'm going to kind of just show you the different headings here on the American Cancer Society website and kind of explain some of the lines a little bit more in depth for you guys. So, some kids, especially when they're kind of in those remission and maintenance phases, but still might need IV medications or might need some of their maintenance chemotherapy, will just get an IV catheter after their central line has already been pulled. And so know that that is an option. Some of those kids with leukemia, as you guys learned in Katie's presentation, have maintenance phases for a couple years after they go into remission. And so regular IVs are still an option with some of these leukemia and pediatric oncology patients. But as for central lines or central venous catheters, which is abbreviated as CVC, there are kind of three different main catheters to focus on. So the first one is the port, which is the kind of the hidden one underneath the skin. This is accessed with a needle, and a lot of kids call this their button, or I have other kids call it their bump before, and so kids kind of name this, and kind of it becomes part of them for their treatment. The nice part about the port is that kids can shower and fully bathe and submerge in water with this. The downfall is that it is accessed with a fairly large, usually about a ½ inch needle for their treatment, or when they come into the emergency department if their counts are down and if their blood counts are down and need some medication or antibiotics. Ports then run up through the main vein into the neck, and so usually kids have a little incision kind of mid-neck, and then also one that's about 1 inch to 2 straight across right on their chest. You might hear, depending on what hospital you are at, most hospitals call them just ports, but a lot of hospitals might call their port whatever brand they use. So I've heard them referred to as portacaths, which you'll see down here. So there's portacaths, barred port, passport, and then the Metaport is also really common. So I would say the Metaport and the portacath are kind of the two most common kind of brand names that you might hear physicians or nurses or families even refer to their ports as. The second kind of central line is a PICC line. PICC lines are used all over the hospital, not just for pediatric oncology or leukemia patients, but PICC lines are a really great line that can be placed either at the bedside, in a treatment room, or sometimes they're placed in interventional radiology if a kid does need some sedation medication. PICC lines are placed inside the upper arm, and they're kind of threaded through with a special, it's almost like a really thick or a really thin metal kind of threading that threads the catheter through the line, kind of like a needle and an IV. But these go up through the vein in the arm into the chest, and then they use an ultrasound as they're placing this PICC line so they can see exactly where they're going with it. PICC lines are in for a shorter amount of time than the other central lines. So that is something to note. A lot of times kids get PICC lines placed when they might have just gotten diagnosed or they're still unsure of the type of cancer or leukemia, and so they'll place a PICC line as a short-time access point so a kid isn't constantly getting new IVs or pokes kind of every day or every couple days, and so therefore a PICC line can be just a great short-term access for their central line. The reason why they don't keep PICC lines in as long is just because of risk of infection, and because the veins that they're putting them in, they aren't surgically placed, and so they're not as deep as some of the other central lines that can stay in up to, a couple years. The other thing to note about PICC lines is they have two kind of catheters and tubes that hang out of them, kind of in the upper arm. And so PICC line dressings kids go through pretty often. Every couple days they have to get their dressing changed, which can be sometimes traumatic for kids. And so being present as a child life specialist is really important when those PICC lines are placed. And then also for their dressing changes, as well as the preparation before a child would get a PICC line. So you can kind of see here that PICC line, how it's kind of, the two tubes are coming out, and there's a vein that it goes over. And then the last one that I kind of want to focus on is what's called a tunneled central venous catheter. This is the other most common, which Katie referred to as a Broviac in her presentation. This is the other most common central line for pediatric oncology and leukemia patients, as well as the port. This is similar to the port in the sense that it's placed in the chest and through the same vein as the port, but it doesn't go up through the neck. It goes right into the main channel going into the heart. The nice thing about these central lines is that they, kids don't have to be accessed with a needle when they're going to give the chemotherapy or the medications for their treatment. They just access those lines just as if they were to hook up something to an IV, and it does not mean that the kid has to get poked every time, which is really, really nice for these kids. Similar to the PICC line, these central lines also have dressing changes that go along with them every few days, which is that sterile process to change all the stickers and the outside of the dressing by the tubes. So that is a big part of these lines and the maintenance of them. They also have, just like the PICC line, they have 2 access points, which is nice for kids getting more who have different medications that they're given, or maybe a kid needs liquid nutrition, which can only run through one line. And so a lot of times with these lines, they'll do blood draws and one medication in one line, and then they'll do other chemotherapy drugs or other maintenance drugs or antibiotics through the other line. And so it's nice that they have more than one point of access. This catheter also has some brand names, so depending on the hospital that you would be working at as a child life specialist, it's going to be either usually referred to as a Hickman line or a Broviac line. Some hospitals just call it a central line, so that's just something that's important to note, depending on the hospital, just like the port is what brand they might call it. The 2 other brands are Groshong and Neostar. Those ones aren't as common as the Hickman and the Broviac, but just important to note. And then that kind of sums us up. This just kind of goes over, the rest of the website just kind of goes over what to do to take care of it. It talks a little bit more about dressing changes, when to contact your care team. But then the only other thing I want to note for you guys is, like I mentioned earlier, this does a really good job of kind of talking about just like the brief overview of central lines. And so, this first section kind of talks about why you would get one and then how they differentiate between which one you get. And so if you have time, this is a great website and a great resource for you. I will continue looking at your quizzes and your condition overview blogs for the remainder of the day and have those grades in, hopefully by tonight, at the latest tomorrow morning. So far, so good. Keep up the strong work. You guys are doing an awesome job in this class. And then if you haven't signed up for your condition presentation topic yet, please do so by the end of this week. I think there's just a couple of you left, and also continue to use those workspaces as well, and I'll help you kind of structure your presentations and give you guys guidance and support on that. And then lastly, this week you guys will be focusing on cystic fibrosis. Heather does a great presentation about cystic fibrosis, or CF, as you'll hear her refer to it as. She is a child life specialist at American Family Children's Hospital. She works on our P5 and P7 floors, which are our general med surg floors, and then also kind of our intermediate care level floor, and so she is our primary cystic fibrosis child life specialist. So she has great knowledge and great firsthand experience with cystic fibrosis patients. So I hope you learn a lot from her this week. If you have any questions, please continue to email me, and also remember that WebEx online meetings are also an option. But I look forward to hearing from you guys this week as your questions come in, and reading your blogs and looking at your quizzes for this week. So have a good week. Enjoy this fall weather, and I will be in touch soon. Thank you.